Hello. Many a times people are confused. Should they go for an IVF or should they go for IUI? Most of the time they think that IVF is the last resort. I'm Dr. Beena Muktesh, Clinical Director, Silverleaf Fertility and Motherhood Hospital. One should not consider IVF as the last resort because there are many reasons when from very beginning we know that this couple needs an IVF. Reasons are if the tubes are blocked, if she have extensive endometriosis and has tried for some time by IUI and not able to get results. It's like if the husband has got very poor sperm quality, and then in that case also we need to do an IVF. If there are no sperms in the semen, then also we can extract sperms from the testes and do IVF and I.V.F. And there are many more reasons. Suppose they've already done 3 IUIs. Ovarian reserve is low. If AMH is low and she has got very few antral follicle count, in those cases also we need to do IVF because those sperms will not be able to go and reach the egg to fertilize. So these are the reason in which we have to do IVF in younger age also. And one should try IUI in those cases where patient is young, AMH is good, her ovarian reserve is good, and she is not tried for very long time, maybe 1 year or so. But we need to know the success rate of IUI is only 18%, whereas the success rate of IVF ICSI is almost 60 to 70%. When we need more eggs to freeze or maybe embryos to freeze, in that case also we should do IVF ICSI rather than keep on doing IUIs, because if we do IVF ICSI at a stage when AMH is good, ovarian reserve is good, patient is young, we get even better results. We can get more embryos to freeze and we can use them for second baby also. They don't have to go for an IVF because as the age will advance, the number of the eggs and quality of eggs will deteriorate. But in case you have already done an IVF and you have frozen some embryos, then even if your age become 38, 39 and your embryos will be of 34 years age when you've frozen them first. So you should not think that IVF is the last resort, because if you come to us when there are no eggs and when there is no ovarian reserve, AMH is very poor, from where are we going to get the eggs? Finally, we will have to take a donor. Or to avoid that, you should judge or you should go to an infertility specialist to judge whether you should wait for long or should we keep on doing IUIs, or you should wait the disease to subside and do things, or do IVF later on. Meanwhile, you will realize that the eggs have gone and there are no sperms left. Many a time people think that there are no sperm in the husband's semen, so they will not be able to conceive. But let me tell you, there is a possibility that we can extract sperms from the husband's testes and make them the biological father of a child. This is possible in recent technologies. There are many diseases when the offspring is suffering from some disease, they have got some Down syndrome or any other genetic problem in the family. In that cases also you can do IVF and we can send them for embryo biopsy and find out if the remaining embryos or the embryo which we are going to implant is having any abnormality genetically or not. So it's very important to differentiate whether one should do IVF or IUI or wait for some more time or do some other treatment. If you need to know, you must visit a good fertility unit. They will be able to diagnose what do you need and you can have a child. Never wait for your eggs to disappear. Never think it is a last resort. Never come to us when it is already so poor and expect to have IVF pregnancies. We'll have to take donor also. So my advice to you is you must visit any good fertility unit, find out where there is tailor-made treatment. When tailor-made treatment, whether you need IVF or ICSI and you need IUI. they will be able to differentiate. You should not keep on doing IU upon IUI, because that is going to diminish your ovarian reserve. You will have psychological stress, financially you will be drained, and without any result, because as I told you, the success rate of IUI is 18% and it is a blind procedure. Thank you very much.